Hi everyone, it's Dr. Campbell and I am back with another CCA exam review. This is part 5 where we are focusing on domain number 4, which is compliance. Domain number 4, compliance, has a total of 9 tasks that you are expected to perform. I have organized those 9 tasks into identify, validate, perform, clarify, research, implement, update, educate, and then assist. Let's begin with our first area, which is to identify the discrepancies between coded data and supporting documentation. I like to call this particular area a documentation review or a documentation audit. And so essentially what you're looking at here are those situations where the documentation and the code assignments don't line up. For example, let's say that the documentation states that the patient smokes cigarettes and they are dependent on cigarettes. Well, that should be coded to diagnosis code F17.210, which is tobacco dependence, specifically cigarettes. Well, let's say that you are reviewing the supporting documentation and looking at what was coded, and you recognize that the code F17.200 was used instead. And that particular code essentially says nicotine dependence, but it doesn't specifically state the substance. And again, in my example, I said it was cigarettes. So we always want to make sure that we're coding to the highest level of specificity. Identifying these type of discrepancies can be done concurrently, meaning at the time that they're actually coded, or this discrepancy can be identified after the services have been coded, and oftentimes after we've been paid for those services. All right, next up, validate codes that are assigned by either a provider or by an electronic system. Today, we have lots of ways in which codes can be assigned. For example, let's take, for instance, evaluation and management coding, E&M. There are a lot of electronic medical record systems that can suggest to the provider what the E&M level should be. While those systems are great, there are situations or portions of the note that system does not take into consideration. For example, the system can pick up when the provider is using a pull down list or clicking on a radio button. But what if the provider free text information? Oftentimes these systems don't know how to count the free text information, and that's why a coding specialist is needed to validate those codes to make sure that we can take into consideration all factors that would impact code assignment. And so it's not just the electronic medical record that could be used. We have software programs such as computer assisted coding software that is basically suggesting codes based on what the system algorithm has been designed to pick up. And then in some of our offices, we still have paper systems that are being used. And you may have a situation where the provider is using a super bill or a charge ticket or an encounter form to select the codes that they want to assign for that day. Well, as the coding specialist, you may be responsible for reviewing the documentation to make sure that the codes are lining up. Next up, perform ethical coding. So there's a couple of things that I think is very, very, very important for you to know. Yes, as a professional, you should ensure that you abide by our standards of ethical coding, our ethical standards that AHIMA has designed for us. For purposes of the CCA exam, it is critical that you read and understand the AHIMA standards of ethical coding, the AHIMA Code of Ethics, because you may have a question on the exam where you're expected to know how to apply those different standards. Also, most organizations have a coding compliance plan, and the purpose of the coding compliance plan is to ensure that everyone in the organization is performing the coding function based on established standards. All right, next up, clarify documentation through physician query. This is known as the query process. AHIMA actually has a wealth of resources available when it comes to the physician query process, and I highly recommend that you download those. Some examples are the article that AHIMA has called Managing an Effective Query Process. Another article that they have is the Query Practice Toolkit. I highly recommend that you review those documents because they have examples of what I like to call the who, what, when, where, and how to the query process. So for example, what is a query? So we know that a query is communication that allows coders or clinical documentation improvement specialists to improve their accuracy of coding by involving the physician in clarifying documentation that the coder or clinical documentation improvement specialist may be faced with reviewing. As you know, the guidelines state that a joint effort should be undertaken by the coder and the clinician to ensure that accurate and complete documentation. And so the query, whether it's written or it's oral, there are certain standards that we have to follow. So that's kind of like the what is the query. And again, AHIMA Query Practice Brief from AHIMA, the AHIMA Toolkit, excellent resources for reviewing this process for your national exam. So why do we query? We query because there are situations where the clinical indicators are pointing towards a more specific code, but the provider hasn't come out and actually said that specific diagnoses. For example, heart failure. Heart failure could be congestive heart failure, it could be systolic heart failure, it could be diastolic heart failure, it could be acute, it could be chronic, it could be acute on chronic. And so sometimes the physician doesn't state those specifics, and we need them to state those specifics in order to assign the appropriate code level. So when do we query the provider? We already said why. We want to make sure the documentation is complete. When do we query? Situations where the medical record information is conflicting. So let's say you have a specialist and you have the attending physician. We always are going to query the attending physician because the attending physician or provider, they're known as the captain of the ship. So if the attending physician says pneumonia and the consultant says streptococcal pneumonia, you want to query the attending physician for clarification. So when it's conflicting, when it's ambiguous, when it's incomplete, when you have lack of clarity, and then according to the AHIMA Query Practice Brief, we can also query for situations like present on admission indicators, just to name a few. Now, it's important to note that we do not query a provider to question their clinical judgment, okay? We don't do that. We don't query the provider when we're trying to get more money. We don't query to increase our reimbursement. We don't query when the clinical information is insignificant or irrelevant. We don't query when we're just not sure about coding rules, because physicians aren't coders. So you have to know that our providers, they are caring for a patient's life, and we want to make sure that we respect their time. That's so important. So again, for purposes of the query process, know your who, what, when, where, and whys. And again, in the AHIMA Practice Brief, excellent information. All right, next up, coding changes. So on the CCA exam, you're expected to be able to understand the process of researching the latest coding changes, implementing the latest coding changes, as well as updating your charge ticket or the fee ticket. Remember I said earlier that some providers use a paper charge ticket, and so as the coding specialist you have to make sure that that charge ticket is accurate, because you don't want the provider utilizing old information. So the latest coding changes, as you know, ICD-10 CM and ICD-10 PCS are updated every October 1, the code set and the guidelines. Every January 1, CPT and HCPCS codes are updated. So as the coding specialist, very important that you research the latest coding changes, that you are aware of what they are, and then if there are any changes that need to be made relative to a paper-based ticket or your electronic system, you want to make sure that that current information is in the record on the day that those codes are effective. There is no grace period for use of those records, and so we are use of those codes, and so we want to ensure that that information is accurate on the day that those codes become effective. So speaking of those codes that become effective and the day that they become effective, you don't want to let a provider know about a new code after it has happened. So as you're researching code changes, when you identify some rules and regulations that are impacting your provider's practice, you want to educate the provider on additional documentation requirements that are going to need to be met, and also what if a code was deleted and if the physician has to use a different code. You want to educate them. Now you know that you are querying providers, you are reviewing documentation to identify discrepancies. Well, you should also share those common trends to your providers, because you want them to be aware of things that you're seeing, so that we can decrease any incidences that are related to fraud and abuse. Because as you may or may not know, our organization may be, I'm not going to say maybe, will be subject to external audits. So the last task that you have to perform is being able to assist the organization in preparing for an external audit. So organizations like your payers, the RACs, the MACs, the ZPICs, the CERT auditors, they have specific requirements that have to be met when they request documentation from you. For example, many of these auditors, they have certain format in which the record must be released to them in. They have certain time frames in which the records must be released. And so if you are responsible for assisting the organization in preparing for these audits, you want to know whatever the rules are, because here is one rule that it's hurtful to the organization. If one of these payers request the record and you don't send it in, guys, it is an automatic error. Automatic error. So it's very important that you understand all of these different external organizations and what they're potentially are going to be asking you for, and so that you can respond accordingly. All right, guys, well, this has been your Domain 4 Compliance CCA review. And next up, we have Domain 5, which focuses on information technologies. Thank you so much for listening, and have a great day.